So hello and welcome to my channel. My name is Jeanette. And in today's video, I wanted to talk about getting prepared for a nursing job interview. And now some of these tips I'm going to talk about can relate to any interview. So you see the job that you want. Personally, what have always done, I look at the job posting and then I look at the description, look at the responsibilities, look at the duties, look at the requirement of that job. I take lots of what is already in the responsibilities, in the duties. I look over those to be sure, do I have what is asking for? Now, if I have at least 50%, half, 75% of what is asking for, then for me, it's a go. Now I turn around and I use some of those same words that are in the job responsibilities and the duties, and I incorporate those into my resume. Because you have to remember, multiple resumes are coming across people's desk every day. You have to weed out what you want and what you don't want. You just cannot go through all of these resumes. So more than likely, what is going to catch the eye of the person is basically what they're looking for, what they have put in their job description, their responsibilities. So I ensure that some of what they're looking for, once I know that I have that, I put that into my resume. Then, if it talks about the requirement, meaning like some jobs may say you need to have a BSN, they prefer a MSN, but you need to have a bachelor's degree at least. If I know I have a bachelor's degree, I know that I have what they're asking for. Now, in the next 3 years, 2 years, sometimes they can help you to actually get the master's degree once you are hired by that person. So don't let that stop you at all. Now, I say be honest though, because I don't want you to put there that you know how to do EKGs when you've never even done an EKG. No, everything you're not expected to know, and everything, there is no way that they would expect you to be able to have everything that is listed in that job description, but they're looking for who has the most. And when resumes will come across my desk, that's exactly what I'm looking for. What is the best fit with also this person's experience they've had before, that I can bring that person in and make them a part of my team. Now, I say, once you've incorporated those words from the responsibilities and the duties into your resume and you've sent that off, now to me, you should now take the chance to go and gather like your documents, your nursing license. Make sure you have your BCLS cards, your ACLS cards. If you're certified in any area, make sure you get that certification card. Like I'm certified in the peri anesthesia care unit. I have worked in PACU for some while, so I did do that certification. So if I wanted a PACU job, I'll make sure that I have that, make sure it's up to date, because that has to be renewed every 3 years. So I'll make sure I get that. Now, certain job also, you may have to do some sort of testing. Like I'm going to use, for an example, when I moved from one PACU setting to another, I had to do an EKG test. I had to do math testing. And now it's only fair, because you are the one that's taking care of these patients that are just waking up after anesthesia. You should know the rhythms. You should know if something is lethal or not. But guess what? Some people are stronger in one area than another. So if that is not your strong point, you don't know if a test is going to come up, go grab your books. Amazon has all sorts of books. Go grab your math books from when you were in class in nursing school and start to do your calculations, because you may think like they may not ask you, but believe it or not, sometimes they do ask for these basic calculations and EKG testing. That's what I will do. Now, I tell people, also think of the way you're going to send in your resume. Sometimes I know people send resume in Word form. I think personally that PDF may be the best form, just because of the formatting when you actually open it up, what it looks like. Now, sometimes people have gaps in their resume, and I said that's okay. I mean, it is okay to have gaps in your resume. You just have to be able to explain those gaps. Now, some people have taken time off, whether to raise family. Some people took time off because they went and did some other type of schooling, and nothing is wrong with that. Now, I'm going to tell you what I wouldn't want to see in a resume, though. One time a resume came across our desk, and the person who had started as a new nurse got burnt out and left that and went to care for animals, and nothing is wrong with caring for animals. But right in the middle of her resume, she wrote a whole paragraph of how if she had stayed in nursing, she was so burnt out, it wasn't working for her, and that was the reason that she left and went to take care of these animals. That didn't belong in there. That does not belong in there. You just put, I worked from 2012 to 2016 at blah, 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 blah. From 2016 to 2018, I work at PetSmart. You know, leave that space so that when the time comes and you get interviewed, that's the time for you to speak about why there was this gap in your nursing career. So to me, leave them in suspense so that they can actually bring you in for an interview, because they may be curious of why was there a gap. And we all get that time when we feel so burnt out in nursing, and some of us do take some time off. So don't be afraid if you have a gap in your resume. Just be ready to explain it. So I said, just to recap, you make sure that you look at the job description, the responsibilities, look at the requirements, incorporate some of the responsibilities and the duties into your resume. Make sure your resume, when it comes out on the other side for the person to read it, that it's legible, that the format is easy to be read. If you have gaps in your resume, that is fine. Just be ready to explain those gaps. And then in the meantime, when you are sending out your resume, go brush up on your math scale, your EKG scale, whatever you think that you're not the best in, or you just need a little refresher, you go and you just refresh yourself and that until they call you. If you do these things, I guarantee you will get a call for an interview. Now, I don't want to make this video too long, so I'm going to do a part two. The part two is going to be, now when you do get called for the interview, what should you do? Until next time, be well.